Okay. Hey everyone, Dr. Gigi here. And I'll wait a little bit for everyone to tune in here. So, just bear with me. This is a new application. I'm going to try to navigate through this. So, if once you tune in or if you watch this later on, just, leave a comment below. Let us know where you're watching from, where you're at, any questions you may have. And I love to answer those there. So, we'll go ahead. And so today, what we're going to be talking about, what I'm going to be covering is how you can, start preparing your body as a pregnant woman to be able to have a natural birth and give yourself the best, opportunity to do that. And also how chiropractic can help you during your pregnancy and make it a lot easier for you. So, a little bit about me. Let me just change here the slides. Okay. So, and I'm going to open up your comments so I can see that, so I can answer as you write those in. I can answer those comments there. So before we start, just a little bit about me. I'm Dr. Gigi. I'm a chiropractor. I work at Ignite Chiropractic and Wellness. We're located in Palm Harbor, Florida. I've been working at that office for about now 3 years with Dr. Serrano, so it's been really great. And I'm actually Webster certified. So that is a specific technique that is used for pregnant women. And not only, but it's very popular for pregnant women. And I will be going in more depth what exactly that looks like and what it is as we go on with our slides. So, actually, when I first started, I wasn't that really focused with pediatrics or prenatal care, but that kind of, my interest kind of got sparked once I started when I went to a mission trip in Haiti, and I got the opportunity to see a lot of kids and a lot of pregnant women, and just seeing how well they responded and how quickly they responded to chiropractic care just really made me fall in love with kids and pregnant women. And that's the only way that we really can change society, and that was really big for me. If we can start from a child as soon as that, and we can change their health for the better, then they're going to grow up and be healthy adults. And then as they grow and they have their own families, they're going to have healthy families. So that is our goal, and that's my passion there. And it all starts from the womb, right? So let's get just started in here. So some statistics here, starting out. So the latest statistic, which is from 2018, the cesarean rate, delivery rate by in 2018 was around 32%, and in Florida it actually is higher than that. It's at 36%, as you can see. And actually, the World Health Organization suggested that C-sections that are above a rate above 15% is actually excessive. So why do we end up like this? Why does this happen? How come 1 in 3 women are giving birth by C-section? And I'm not against that. There is always a time and place for anything, and C-section can be important and very in emergencies. They can save the life of the mother and the infant, and they're very necessary. But a lot of these cesarean, pregnancies, deliveries happen, and they're not an emergency. They can be planned from before, because that's what is best for the hospital and things like that. And so it all comes down to the fact that there's not enough support, right? There's not enough support for the moms, and empowerment that they are actually they have the ability to give birth, because we kind of teach we use birth as something like a condition, and it's not a condition. It's something that is very normal. It happens everywhere with every mammal in the world. And the funny, and Ina May, which is a well-known midwife that's written some really nice books. You can look her up. She's done TED Talks. She's awesome. One of her books is Guide to Childbirth. She actually said, we are the only species of mammal that doubts our ability to give birth. Our bodies are intelligent, are made for this. So We can do that. So we just have to have that support and the empowerment, and that will decrease the fears. If we actually know how our body functions, will decrease our fears towards birth. Um, Another thing that is not really talked about is how um, C-sections are actually a surgery, and they do come with all the risks that a surgery comes with, right? And even studies have shown now that the children that do get born by C-section have a lower immune system because they don't go through all the bacteria as they come out of the vaginal canal. They're more higher risk of them having asthma and things like that. So we know that there are some risks with having C-section. Obviously, when it's necessary, then it has to be done. But if it's not, why go to those extremes there? So those are some things why C-sections are so common now in the world. Um, so, where do we start from? How do we navigate this as a pregnant woman? It comes all down to, what do you want, right? You have to ask yourself, you have to have a plan, and you want to know what kind of birth you want to have. And that question can only be answered by you, and or have a conversation with your partner and decide, what does that look like for you, and then what are those necessary steps that you need to take to achieve that. So do you need, you have to um, get those people around you and to have the support group that is aligned to what you want, whether it is the right birth professionals, whether it is going to be a midwife or a doula or a OBGYN. Knowing those things, knowing if you want to have a birth in a hospital, at a birthing center, at home, it depends on where you're at. For some people, it is more comfortable if they're actually at home because they can move around. It is a familiar place, less stress, which is really important when you're at a time of delivery. You want to decrease that stress so that you can focus on actually what's going on and not panic. For other people, actually, that can be something that is not that um, good for them, because they want to know that they have the medical hospital around there in case of emergency, and that is great too. You just have to figure out what works best for you and what you need at that point, because if you don't have that already planned out before, when the time comes and it's ready to deliver, you're going into panic mode, which can actually be a issue at that point, because you're not going to do the things that you wanted to do and you wish you had done at that point. So supporting yourself with the right people around you, and getting all the knowledge, and don't get it from one place. You want to look into different sources, and get a wider range there, and know what the best options are for you at that point. So, with that being said, something that we go through with all our patients and the office, that we ask every patient, is, how do you know that you are actually healthy, right? A lot of us go by the how I look, how I feel, and it kind of stops there. But there's so much more to health that we cannot see or feel, and we're missing out on a lot of that. So, what it comes down to is actually how our body is functioning. That is the key component to health. And what does that mean? That means, how is your body adapting to the stresses around, to the environment? How is your immune system doing? How are you functioning? That is where true health comes from. And for anything to work, and where that is all put, it is in our brain, and that our brain is a part of our nervous system. So our brain is connected to each of our organs through our nerves, and that's how we can, our heart can beat, our lungs can breathe, we can digest, we can develop a baby inside of us. That's how our body works. Without that network of the nervous system, we wouldn't be able to do those functions and keep ourselves alive. So that is where what you want to, yes, of course, what we feel is part of it, but also knowing a little bit deeper and making sure that you're actually functioning properly. So what are some things that will affect your health? Some of these things are the 3 T's we like to call in chiropractic: toxins, traumas, and thoughts. So for Toxins, I mean, those are chemical things that going on in our body that can come from, our diet, from the foods that we eat, the drinks. It's very important. Actually, studies have shown that in our umbilical cord, a study that was done by the Environmental World Working Group, they found that there was an average of 200 industrial chemicals and pollutants in the umbilical cord. And among those pollutants were pesticides, food additives, waste from burning coal, gasoline, and garbage. Things like that. Those are things that were found actually in the umbilical cord. So that is very important to make sure what we're eating, they're not full of pesticides. We're getting the proper nutrients. This is a whole topic of its own, which I'm not going to go in too much depth right now. But some, key things that you want to have. You want to have a prenatal multivitamin, and some good sources for that is New Chapter Perfect Prenatal Multivitamin. Buried Treasures has a great prenatal supplement, and Garden of Life Raw Prenatal are all really good sources for all those different nutrients that you would be needing, like folic acid, right? Um, you also want to have a good supply of calcium, making sure that you have enough calcium, because when you are pregnant, you can get depleted very easily, and that can lead to osteoporosis, osteopenia later on in your life. Also having the proper amount of iron. If you have too low iron, that is can cause a premature birth, miscarriages, low birth weight, postpartum depression, and even they found in infants later on, once they're born, that they have abnormal auditory recognition memory. So all these nutrients, we have to make sure that we're supplying our bodies with all this stuff as we're pregnant, to make sure that our babies and us are healthy and developing properly, right? So cleaning products, personal care products, all these things can have toxins that can then, you know, directly cause issues for you and your baby as it's growing. Another big thing is traumas. That's the physical component. You can have traumas can be from car accidents, whiplash accidents, falls, poor posture, right? Repetitive motions. Those are the most common now, where we sit all day, right? And those can, affect and cause a burden to our health, because these are all stressors that our body has to deal with. Another big thing is the emotional stuff, thoughts, right? They can, like depression or emotional abuse. If you're very negative, very worried all the time, this can, come out as even it can present itself as a physical issue too. And I'll explain that as we go through what misalignments in the body do and all that. But it also can, increase different hormones like cortisol in your body. And that overall will put you in a flight or fight mode, which is something that you do not want to be in when you're especially pregnant, where you want to be in that relaxed stage where you have growth, because you're going to be growing. You don't want to be in a protection mode where you're ready to, run, right? And your body doesn't really know how to deal with these stresses, because it doesn't understand this is just a stress for it. So it will, increase your blood, your blood pressure and all this stuff, as it's like you're running from a tiger, even though it is just you worrying about your job or something like that. So obviously these things happen daily in our life. It's so much that we can prevent many of these and try to do our best, but some of these are unavoidable. So the biggest thing is to know how to deal with these things. So if you are worried, take a few deep breaths, make sure, let things go. And that way, that will help you through the different times where you're having this emotional stress. So these stressors here actually can lead into what we call in chiropractic subluxations, or misalignments of the spine, or it can be of the pelvis, especially when we're dealing with pregnant women. And these can adversely affect your nervous system and the ability to regulate and function, which we said is a big part, right? While especially while you're pregnant. So what do these limb misalignments look like? It's like having it's areas of your spine that get fixated and are not properly moving, and our body does this happens all the time, and our body is well equipped to take care of those. But when something is chronic and continuous, or there's a big traumas that we saw, or things like or chemical or emotional trauma stressors, these can fixate those areas in our spine and cause dysfunction, and cause wherever these nerves that are coming out of the spine they're going to not be able to communicate properly with our brain and do the proper functions for us. So it's kind of like a blind spot, I would say, of those areas, because our brain and our mind thrives off of movement, and we need to have those movements so it can tell where things are in our body and make sure that those messages from the brain to the body and vice versa are going back and forth intact with no problems. It's kind of like thinking of, you're trying to write a text message, but you can't see your screen, and you're like you have your eyes closed, so you might kind of like know where some of the things are and some of the words and some of the letters and write it out, but it probably is not going to be the right message, or it's going to get delayed. So that's what happens in our bodies when we do have these subluxations. Our brain can't process properly what it has to do and how it has to function. So that is really important as or as you're pregnant, to make sure that your nervous system is functioning properly. So in pregnancy, what does stress look like, right? So as I was saying before, if you're have high stress, then and stress is all those components, whether it's chemical stress on your body, whether it's a physical like a trauma, or it's emotional. This puts your body in a flight or fight mode, and our body our nervous system it has a voluntary part of it, whereas where we can move our muscles and do things that we can think of and do and speak and do all that stuff. But there's a part of it that is the autonomic part, which is the involuntarily part of the nervous system, where it does functions that you don't even think of, like breathing or your heart beating, things like that, right? So if we are in that stress mode, there's a lot of stress and your body can't deal with it, then we are in a constant fight or flight, and that is not going to be good, because during pregnancy we want to be in that relaxed state, so that the baby can grow, so that properly and develop properly. Another thing is, with stress, it also elevates and decreases different hormones in our body. So if you have a lot of cortisol, that is going to affect your baby, because that's what, if you're stressed out, then your baby is going to be stressed out. If you're happy, then your baby's going to be happy, right? So I don't want to say that to make you be afraid of it or fear of that, but just be aware of that, and knowing how to deal with different stresses. As I was saying, take those deep breaths, take the classes you need to do, maybe meditate, maybe walk, different things that you can lower that stress. Eat the proper foods, sleep. All these things are important as you are as you're growing and as your baby is developing. Another thing that we see is spinal and pelvic imbalances. And what this causes is an array of things. And this is why I do see a lot of pregnant women. It is for low back pain, right? When you have, as you're growing, there's more weight in front, you get more of a curve in the low back, which can cause low back pain. It can cause sciatic pain, which is the pain that goes down the leg, rib pain, very often round ligament pain, which is the pain that's in front of the stomach, down low in the abdomen area, and intrauterine constraint. That's another thing. So when we have imbalanced pelvis, that it will tend to pull different muscles and different ligaments, and I'm going to go in more detail, are going to pull on the uterus, constraining it, making it difficult for the baby to grow properly, to be able to move in the right position. So that constraint in the uterus can cause pain, and it can cause discomfort for the baby and yourself. Also, another thing that intrauterine constraint can cause is breech babies. It's not the only thing that can cause breech babies, but one of it is. And I've seen a lot of pregnant women, and that's very rewarding to see with breech babies. Even with one or two adjustments, we can get the baby to turn to the proper position, and that's because we've taken that tension off of that pelvis and off of the uterus, so the baby has more movement. Obviously that's not always the case, and I mean, you might be even going to the chiropractor and have perfect aligned pelvis, but sometimes the baby won't turn. And that is a time to know that like your body's intelligent, so is your baby. It's smart, and sometimes it doesn't turn because there's a reason that it doesn't need to, it can't turn. It might be because there's a short umbilical cord, or if it did flip downwards as it should, it might wrap around the umbilical cord and cause an issue. So there are different things that can cause a breech baby. So it's, yes, we want to have our baby to be comfortable as much as it can, but we don't want to force it in the right position, because that might not be the right position for your baby. So just having that in mind there. So I'm going to go actually first to this. So going more into what does it look like getting adjusted as a pregnant woman. So the Webster technique, as I said, is a specific chiropractic analysis, and it's an adjustment that we do, and our goal is to adjust and reduce the effects of sacral subluxations, so sacral misalignments, or SI joint dysfunction. And the joint dysfunction, hopefully you can see where I'm showing with my arrow there. These are where your SI joints are in the back there. So those areas are where your sacrum meets the pelvis, so they can get misaligned. And why these get misaligned a lot of times is because during pregnancy, you have to grow, your pelvis has to grow so that your baby can develop. And you secrete a hormone called relaxin, and it does exactly what it says. It relaxes your ligaments. And so all these white things that you see, these bands that are holding together the bones, these are actually ligaments. And with the relaxin, they start getting more flexible and relaxed, so that your pelvis can grow for your baby. So we with our adjustments, we do contact different muscles and ligaments that are attached to the sacrum and to the pelvis, to make sure that you have a balanced out pelvis there. And it is done. We don't need to take x-rays to do this analysis, and it is pain-free. It does not hurt, and very light adjustments, and a lot of muscle work we do, and soft tissue work, and also adjustments within. So that's how we can help with the different things that are going on. So some benefits that we have from chiropractic during pregnancy is that we can provide greater comfort, as those symptoms like the pain down the leg, all these things can be helped with chiropractic. We can reduce the average labor time, encourage the optimal fetal position, right? If there's a breech baby, if it's, because it's constrained and the uterus is not in the right position, and it's getting an imbalanced pelvis, that can cause that baby not to be able to flip in the proper position because it doesn't have the room. So with chiropractic, we can help with that. It also relieves back and pelvic pain, and it just overall supports natural labor and delivery. So that is some of the stuff there. I hope I went through everything. I don't see any, questions yet to, go over. But if you have any questions, please let me know. I can definitely answer those at a different point if you see this at a different time. So just closing here, I just want to say that if you have more questions of, about natural birthing and what you can do and who you can contact, you can always look at our, go to our website, which is, I'll put it down here below, at ignitechiropractic.com. You can call us at the office, and I'd love to talk to you, and help you with any questions that you may have. But the biggest thing is to remember to not treat this as a condition, and do not be fearful of it. The more you know how your body works, the better it will be, because those fears will kind of melt away, because um, you'll realize that your body was made for this, and it's not something to be feared of. As long as you have a plan and you know what you want for your, for your pregnancy and for your delivery, everything should, go as planned. Um so yeah, if you guys have any questions, please let me know. Hopefully this was helpful for you guys. And keep in touch there. Have a great day.